Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us. Hi, we are here with Dr. Vail Reese, board certified dermatologist, clinical faculty at UCSF, founder of Union Square Dermatology, and has been in practice for over 28 years. So really excited to have Dr. Reese here. And today we're talking about a very fun, exciting, and just innovative idea that Dr. Reese does. And that is his conjunction of dermatology, but also media, movies, cinema, and he can explain it so much better. So thank you so much for being here, Dr. Reese.
Thank you for having me. Yes, like I said, I've been in practice 28 years. My background growing up as a teenager was I thought I would actually go into film or acting. Obviously, went in a different direction. But when I started my dermatology training at Brown in the early 90s, I would go and see films as I normally would, but I was now seeing it with the perspective of as a dermatologist and realizing that, oh my gosh, film as a visual media is really uses dermatology much more than I think you would actually think. And that led me down this path of exploring, well, if we're seeing a skin condition in a movie, can we categorize that? What does that mean? And it's been quite a ride. I've been doing it for over 20 years.
That's fantastic. And I was looking at your site, and it's, if I'm saying it wrong, let me know too. It's so www.skinema, basically like cinema.com. And it's fantastic, like what you have on there. It's so thought provoking. You have the different conditions kind of associated with what we see in the movies. So there's that really fun media, social media type of more superficial thing to look at. But then there's this huge deeper undertone of how our culture is based and kind of what we see on the screen and these impressions that you make, even like you mentioned, even going to the movies from earlier on ages, we sort of get these like imprinting of ideas from what we see in media and movies. So I'd love to, yeah, just hear kind of what got you started with that and anything specific that you want to add about the conditions you've noticed, like what conditions you see in the movies the most and associated with what sort of like personalities and characters within the films.
Absolutely, absolutely. So when I began to categorize these findings, and this was originally published actually in 1995 in the JAD, I found that there was a broad category of evil characters who had skin conditions. In fact, if you see a skin condition in a film or a cable TV show, fictional show, it usually is going to be associated with an evil character. So the ones that come to mind, say Darth Vader from Star Wars, or Scarface, Al Pacino, or Freddy Krueger. Those are extreme scars, but even some minor scars are used to show evil characters. The second category that shows up in film and media are skin conditions you can see that actually the actor just has that condition. The actor might have a birthmark. For example, Tina Turner has a Port Weinstein birthmark, or had, rest in peace, a Port Weinstein birthmark on her shoulder. So these are birthmarks that the actor actually has that may be seen in film or media from time to time. And then the final category, which turns as much less likely, is a character in a film that has a skin condition, but it's not the evil character. It's the heroic or sympathetic character. And examples could be Tom Hanks was in the film Philadelphia. His character actually contracted HIV disease. And this was in an era prior to antiretroviral treatment. So the Kaposi sarcoma that they recreated with makeup played a central role in that film. And yet he was not an evil character. This was a character who was sympathetic. He actually won an Academy Award for that film. So these are the broad categories, and that's where it really begs the question: why? Why are skin conditions associated with evil? And it's something I've certainly explored over the years. I think what happens is that a lot of film, especially early film, is an extension of Gothic literature. So you had back in the 1800s novels such as Frankenstein with the scarring, or Dracula with that kind of pallor, or the werewolves with hirsutism. So I think there was kind of a almost a literary language that film developed. But I think also, given that film is so visual, and if you're telling a story that involves heroes and villains, how simple is it? Rather than getting into a lot of dialogue, like watch out for this character, instead, you use makeup to create a dramatic scar. You play the spooky music, and audiences immediately know what they're dealing with. And that's also true for international cinema. So you don't have to speak a specific language to recognize, the dramatic music. The character has alopecia, like say Dr. Evil from the Austin Powers series, or many of the James Bond villains, and it's a visual shorthand. But I think the downside of this, or the concerns I've had looking at this over the years, and impacting patients also, is stigma. Whether or not we basically, as moviegoers from an early age, are taught that if there's abnormal skin, that's some reflection of an immoral state. And part of the issue for which is I think is really something we've explored. We've actually written papers on uh, looking at this in animated film and in children's film, the Disney films. How many of those characters show,
Yep.
like for example, the Lion King, the evil character of the Lion King. Now these are lions; they're not humans, but the lion is actually named Scar. He's the young protagonist's uncle. He's got a facial scar. He's evil. He's trying to kill the protagonist. So here's a kid, 3, 4, 5 years old, watching what seems like a fun Disney film, but perhaps learning, perhaps being imprinted that if you see a scar, this is someone to be avoided. And then how that impacts our patients, of course, is when they come in and you identify some non-melanoma skin cancer, and we'll talk about Mohs surgery or other options. I've literally had patients who had no idea I was into this topic bring up to me and say, well, I don't want to look like that monster in Frankenstein. Think of that, really. They are not just concerned about how it looks aesthetically. They're worried about being compared to a potentially evil and scary character. So it's very prolific. One area that I think in particular we pursued with this was the use of albinism. So albino, albinism, oculocutaneous albinism was used for years, for a few decades actually, to show evil characters. And in retrospect, it's kind of shocking, but they would take, say, an actor, and they would actually put white face makeup on them. They wouldn't cast someone with this condition. They would put a kind of a white fright wig on them, perhaps some red contact lenses, and cast them as an evil assassin. This happened actually time and again. The most famous example would be the Da Vinci Code film, again, actually with Tom Hanks as the hero in that one. And we actually I ended up working with an albinism advocacy group, really to address this stereotype in film. And we did actually a whole promotional campaign in regards to that Da Vinci Code movie. And lo and behold, that stereotype has actually kind of dropped off from film and TV, which was really gratifying and exciting, because having that on screen actually impacted especially kids with albinism in school. A movie like the Da Vinci Code would come out, and there would be this uptick in bullying and harassment of them unfairly and unnecessarily. You really didn't have to play that role on this basically genetic condition.
This is so fantastic, and it's something that is so obvious when you say it, but for some reason we have myself before looking at your site and really looking at it, I didn't really think of that aspect of the harm that that kind of imagery does, but also just even thinking of my own personal view of the world, because I also love movies and have spent a lot of my, as many, many physicians were a little bit of a nerdier indoor type. I shouldn't stereotype, but I'm guessing a lot of us are kind of into different medias, and we've watched a lot of things and read lots of stories, and this pattern continues in kind of everywhere, for starting from early childhood, like you mentioned, even Disney. So how much of this is just imprinted? One, it's, I feel like you say, we have to protect our patients, like you did with like the albinism community, but also it just kind of also, I feel like, is that barrier in a room with a patient that we have to address. If you are going in and saying, oh yeah, 2 millimeter basal cell, we're going to cut it out, it's going to look like this and this and this, and you're moving on, but maybe the patient is thinking all this other things that's kind of happens. So it almost in a way kind of makes your job harder too. Yeah.
Well, Farah, that's an actual segue to the second category, which is
Yeah.
these actors that have skin conditions. Have either you can see them in publicity photo and film, or they've actually come forward. with various skin conditions. So you mentioned, we talked about basal cell skin cancer.
Yep.
I actually will use with patients very commonly examples of actors to essentially reassure them. For example, so a patient comes in, we've diagnosed with basal cell skin cancer. We're so used to this, but this is a very new thing for them. I will routinely bring up the actor Hugh Jackman. Hugh Jackman is an Australian actor, grew up surfing in Australia, admits now he didn't really wear sunscreen sufficiently, and has been very upfront with being treated for facial basal cell carcinoma on his nose, on his cheek. I believe he's undergone Mohs procedure probably 3 or 4 times. He's actually given credit to his Mohs surgeon. I think he's based in New York, and has really explained, look, everyone, from a public advocacy point of view, we really recommend sunscreen. But I'll actually use Hugh Jackman also as an example to reassure patients. Look, you've got this basal cell. However, so has this actor Hugh Jackman, and yet he undergoes this procedure. They do whatever reconstructive work they can do so capably to restore the aesthetic appearance, and then he can move on and do more film. So in his case, in fact, I'll tell patients, I'll say, like Hugh Jackman, your film career should not be slowed down by just having this basal cell skin cancer. And there are many, many examples. In fact, just yesterday, one of the Jonas Brothers is this very successful pop music act, Kevin Jonas, who's in his mid-30s, so a little bit young, basically came forward and said, hey, I've just been treated for basal cell
Oh,
carcinoma,
wow.
I think on his face or scalp. So that's, I think, for a younger generation. I mean, most of them will probably know Hugh Jackman, but again, having a younger example of that, I think, is good. Christy Brinkley is a supermodel from the 80s and 90s. She had basal cell carcinoma treated recently. These are all people that are up front. And there's examples of this with respect to rosacea and adult acne and melanoma and psoriasis. And I actually will use these examples with patients to reassure them. So that's kind of segues.
Oh, that's fantastic as well. It's so good to see these things on screen, see people coming forth. Like Kim Kardashian talks about her psoriasis, not a ton, but it's like out there just to some extent. And just people kind of showing that these things happen, normalizing, and they're not anything to be kind of scared of or fearful of. And it's okay to tend to talk about these things as well. And then when you were describing the scars, it made me think of the Mad Max movie. I haven't seen the new one, but it's because I feel like that's like a great movie where they've almost like, I'm sure, spent a lot of time, I'm sure, on the story as well, but mostly on the design of the faces and building the scars and how these characters are going to look. So I almost wonder
Yes.
what these rooms look like in the film planning, when people are sitting there, and because it must be some artistic project that happens probably pretty proliferative before these characters are formed, of like, okay, well, how do we make a scar contract so it's pulling up the lip or it's pulling down the eye. And in the movies, I actually have to pay more attention at the awards seasons, but there's quite a bit of awards too, isn't it, for like the makeup artists and people who are able
Correct.
to like it's a whole field of creating these kind of facial skin characters, almost like, as like you have like your main actors or supporting actors, and you have this like skin part. I feel like probably has a better term to it, but right, there's like a whole industry
Absolutely.
around that.
Absolutely right. Yeah, no, and not just makeup, of course, now, but also
Yeah, yeah.
CGI. They'll use CGI to can create scars. Again, if they don't want, but a lot of these actors will sit
Right.
for hours in a chair getting that prosthetic makeup for this purpose. And then the third category is much less common, which is they use that same makeup and CGI technology, but to create a scar or skin condition for one of the heroic characters. So the one that the kids will know about most readily is Harry Potter, the character Harry Potter. He survives Voldemort's, oh, we're not supposed to mention his name, but the Voldemort's attack, and ends up with this lightning-like scar on his forehead. And yet no one argues that Harry Potter is an evil character. He's a heroic character. And they've also talked about how kids who unfortunately get some facial trauma early on, sometimes they can reassure, oh, well, I'm just like, this is my Harry Potter scar. So and I'll actually use those sympathetic examples. I think that's very helpful for us as practitioners. We're trained to very efficiently diagnose and treat skin conditions, but sometimes we lose sight, as you alluded to, what it is like for this patient outside of our office, and we don't want to lose that empathy for what they're going through. So when you see a film like Philadelphia, for example, with Tom Hanks, it reminds us again what is happening outside of our office, and maybe take a little more time addressing whatever emotional impact these either treatments or skin conditions can have.
Yeah, that's so fantastic. I just love this topic. I feel like we could talk about it for hours and look at different movies and find examples. And then of course you're talking with us. Yes, and this, we have our Grammys there too. And we at our SF Derm meeting too, you're going to be
See, alopecia,
alopecia
right
is
here
a
on a
main one,
heroic
right?
character.
That's a huge one we see as well.
It's alopecia universalis. You
That's
see that?
true.
Yes.
And that's a main one too, right? Just like hair in different areas, like how big of a impact that makes. And we know in our offices, no matter what people come and see us for, everybody asks about hair. It's such a main driver of that imaging.
Yes, and here's another example. So, how often do we treat alopecia areata, little patches of autoimmune driven alopecia? Well, Keanu Reeves, very famous and successful movie actor, has actually had this condition for years. I first noted it in some publicity photos. You could see it in his scalp and his beard, but then more recently he's come forward with it, kind of the struggles he has in coping with it and in treating it. And yet, for patients who come in, I can, again, reassure them, and any of us can, that like Keanu Reeves, they're able to get treatment and, again, continue their film or other career.
Yeah, any other really interesting examples of any other celebrities with any main skin conditions?
Absolutely. So vitiligo, of course, very deforming autoimmune condition, especially if you have darker skin tone, type 3, type 4 skin. But I think her name is Harlow. There's a supermodel, Whitney Harlow is her name. And she appeared on one of these reality TV shows about models with vitiligo. And she has not strayed away from it and has actually become a role model. And interestingly, apparently there's in the Sims video game, you can take these avatars and you can create different appearances of them. But they actually now implemented vitiligo. You could actually give your character vitiligo. So that almost suggests that someone would want that.
Yes.
Which is huge. That's a huge, I think, change. Rosacea, for example, many actors have come forward with rosacea. Cameron Diaz, I think, was the original one, who talked about how she really enjoyed doing the voiceover work in Shrek because it didn't matter how much her rosacea was flaring, she could come and do her job. Whereas, again, if she was shooting in a movie set, they'd have to do whatever they needed to do, treatment-wise, makeup-wise, CGI to cover for that. And there's been many examples. Adele, for example, has rosacea. Beyonce has adult acne. Many examples. Certain actors have undergone treatment with Accutane, so it's nice to reassure patients for that. Matthew McConaughey underwent Accutane treatment years ago. Jessica Simpson, Emma Stone, who just won an Academy Award, was very upfront with her struggles with adult acne and undergoing Accutane. So if people are concerned about treatment with isotretinoin, at least we have these examples we can discuss.
Yeah, absolutely. Because there's so many these commercials too, where everyone's going on with this like little cream and it cleared my acne. And it's so important for celebrities to come and say, well, actually, it was the cream, but also 6 months of oral isotretinoin. So it's so important to actually talk about the real things that are being done because it gives teenagers and other people out there that are struggling with it like a real view of what you need to do to treat something to the fullest. So that's fantastic. Well, thank you so much for sharing all of that with us. And then this is, of course, the Future of Dermatology podcast. So we always ask, is there anything that you're excited about for the future of dermatology or anything that you're looking forward to?
I would say that with regards to the future, it's been so exciting in 28 years of medicine to see incredible breakthroughs that we've had. When I started training, we didn't have biologic treatments. We didn't have the JAK inhibitors. We didn't have these newer treatments for melanoma. So the vaccines that have come out, it's just incredible the amount of breakthroughs that have happened scientifically. And I think the general public kind of loses sight of that. But I'm so proud of our specialty at being at the forefront of a lot of this research. Not just for medical conditions, but certainly from the cosmetic side. I mean, any of the major cosmetic breakthroughs that have occurred during my 28 years of practice have really come from the dermatology side. So I just think, we are headed toward a wonderful time, more use of sunscreen, and greater options to treat our patients.
Absolutely. I can't agree with you more. It's the best time to be a dermatologist, isn't it? We have so many therapies, so many great things coming out. So completely agree. But thank you so much for joining us. I can't wait to hear more on this topic. Can't wait to hear about it at the SF Derm meeting, and watch some more of the images that you have collected.
There's a lot out there. It's the biggest organ and the biggest type of media. So it never, and there's always new examples. This film, Poor Things, that came out with Emma Stone. Willem
Yep.
Dafoe was actually not just the scarred character and evil, but he actually had a sympathetic backstory too. So there's even overlap that we see. So it's a very exciting whole area. I've enjoyed working with it all this time.
Sounds great. Thank you again.
Thank you all so much. I appreciate it.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.